Good day, class. In the previous videos, we have studied the 8 principles differentiation methods as well as its application on specific acupoints. Although we have emphasized the importance of the 8 principle differentiation methods because these are the direction, the principles of your treatments. You're going to tonify or reduce. You're going to reinforce or reduce. You're going to create the heat or create the cold or reduce the heat. These are the direction, the most fundamental principles of your treatments. As we mentioned in the diagnostics when we study the 8 principles, although these principles are very important, however, it doesn't help you to locate the location of the diseases. For example, if I ask you to drive to the north from University of Johannesburg, you can drive all the way to the north, but where's your destination? You need to get something to locate your destination, and then you can arrive. Otherwise, it'd be very vague. You don't know what to do. This is why, after the 8 principles differentiation methods, we need the 脏腑 organs differentiation method. The 脏腑 organs differentiation can help us to locate of the location of your destination. Excess heat and excess syndrome we identify as the patient as an excess syndrome. What excess? Where? So these are the 2 questions that you need to ask yourself. The phlegm or the blood or even the fluid, for example, the edema. What excess? And where? In which organs? In the lung, in the stomach, in the intestine, the lung, the patient may present as cough. In the stomach, the patient may present as poor appetite, vomiting, nausea. So in order to locate the area, we need to focus on the 脏腑 differentiation. The 脏腑 organ differentiation, we're going to discuss one by one, but more specifically, we're going to focus on the 脏 organs because our theory will be based on the 5 脏 organs. Firstly, the lung-related syndromes. The lung-related syndromes, in order to understand these syndromes, you need to understand the functions of the lung, the location of the lung, the connection of the lung. The lung sits in the chest, located in the chest, in the upper chest, in the upper part of the body, in the upper jaw. The lung in charge of the qi, governs the qi, governs the breathing. The orifice of the lung is the nose. The lung system also link with the pipes, the air pipes. Throat, the lung links to the superficial skin. The lung also in charge of the water metabolism. So when you remember all these different functions of the lung, you will know that if the lung got problems, the dysfunction of the lung, then you can know that the common symptoms, for example, cough, something related to breathing, tachypnea, running nose, because something related to the nose, but something related to the throat, something related to the skin. So in Chinese medicine, even in acupuncture, when we treat the skin disorders, apart from the specific organ that's related to the specific disease, you also can think about the lungs, because the lungs are related to the skin. Because the lung locates in the upper part of the chest, located in the chest, in the upper part of the body, the patient may present as chest oppressed, chest pain, cough, tachypnea, coughing blood, runny nose, nose blockage, nose bleeding, sore throats, or loss of voice. So these are the common symptoms of the lung. The lung meridian, the lung organs also related to the large intestine. These are the coupled meridian. These are the coupled organs. The lung meridian, the hands, Shaoyin meridian, the foot's Shaoyin meridian, that's the kidney meridian, also goes to the lung. The foot's Jueyin meridian, that's the liver, also linked to the lung. The stomach, also linked to the lung. The lung meridian originates from the middle jaw, which is the spleen. So as you can see from the relations from meridians, they connect to each other of the different organs. Because the kidney meridian goes to the lung. That's why in the previously when we talk about cough, tachypnea, I always emphasize the treatment from the kidney. That's also the theory from the basic theory. The kidney can receive the qi. So for cough, tachypnea, then we can use points on the kidney. These are the common symptoms, common manifestations of the lung-related diseases. More specifically, we still need to identify which pathogens. When cold attack the lung, in this situation, you need to understand the wind and coldness. What are the characteristics of the wind and coldness? So if you knew the coldness, the patient may present pale tongue, thin white coating. These are the coldness. The treatment principles will be expelling the wind and cold, expelling exterior pathogens, the wind exterior, and assisting in recovering the lungs function. We're going to focus on the hand-Tai meridian. The hand-Tai meridian is the lung meridian. We're going to focus on the hand-Yangming meridian. Yangming, the hand-Yangming meridian, the large intestine, the coupled meridian. We're also going to focus on the foot-Tai-Yang meridian. The reason we need to focus on the foot-Tai-Yang meridian is because the Tai-Yang meridian starts from the blood 1 all the way up to the head and travel on from the back all the way to the foot. So the Tai-Yang meridian distributes more than half part of the body. Very long distribution is in charge of the superficial, which is also related to the lung. The lung in charge of the superficial. Now the foot-Tai-Yang meridian also related to the superficial. In the other situation, a patient suffers from wind cold to the lung. Sometimes the patient may have headache. The patient may have stiffness in the neck. These are all areas where the bladder meridian, the foot-Tai-Yang, is the bladder meridian where it travels. So for wind cold attack the lung, we're going to focus on these 3 meridians: hand-Tai, hand-Yangming, foot-Tai-Yang. You can use lung 1, lung 9, lung 7, lung 4, lung 11, bladder 12, bladder 13 to 14. Bladder 13, 肺腧, 肺. is the lung through its acupoints. The other 12, 风门. Feng is the wind. Meng is gate. So this is the gate of the wind. We're going to focus on the wind. We're going to focus on the organ. We also can use feng qi, the pool of the sea, the pool of the wind. If I know wrong, GB20, you must just double check the number. Feng qi, so also can use to expel the wind. When we study the 脏腑 differentiation techniques with the specific treatments, you need to have your notes of your diagnostics together if you don't remember the symptoms. The wind cold attack, how to identify the wind cold attack, how to diagnose the patient suffer from wind cold attack. The patient must have something wind or superficial. Some symptoms can help you to identify the coldness. More specifically, for the lung, the fluids, all kinds of fluid, must be clear. So it shouldn't be thick, yellow fluid. This goes to the wind heat attack. When we say the wind heat attack or the wind cold attack, wind, superficial, in most situations, this actually refers to the first few days of the flu or common cold. We also need to keep in mind that the wind cold can develop into wind heat. This will depend on the patient's body constitution. The wind heat attack, the patient may present as fever, aversion to cold or aversion to wind, but the fever is dominant. Slightly aversion to cold or aversion to heat, to wind. The patient may present as sweating, thirsty, dry nose, dryness. That's because of the heat. The heat can consume the body fluid. Thirsty, lack of body fluid. That's also due to the heat. The patient may present as yellow, thick nasal mucus. The patient may present as nose bleeding because of the heat and burn the vessels. So once the vessels got burnt, then the patient will present as bleeding. But this bleeding is in the nose because the orifice of the lung is the nose. If the bleeding in the other areas, then we're going to focus on the other organs. For example, the eyes bleeding. It doesn't have to be the bleeding that we can see the blood running out, but such as the red eyes. That's also kinds of heat. Or sometimes you actually can see the blood underneath the eye, and this we're going to focus on the liver, because the orifice of the liver is the eyes. If the bleeding on the skin is actually in the lower part of the body, in ladies, they call excess bleeding in a period in the lower part of the body. We're going to focus on the spleen. So as you can see here, the same bleeding, the nose bleeding, that's the lung. The patient also may suffer from sore throats, swollen throats, cough, the coughing with yellow thick phlegm. The patient may present as constipation, yellow urine, scanty urine, red tongue, yellow coating, floating pulse, floating rapid pulse. These are all the symptoms that's related to the wind heat attack or the heat attack of the lung. The treatment principles will be expelling the wind and the heat, dispelling the bacterial pathogens. No matter wind heat or wind cold, these winds are bacteria, so we're going to relieve the bacterial pathogens. Once you've got the treatment principles, you can decide the treatment techniques you're going to use. Because this is the heat, you're going to use acupuncture with purging methods or to prick for bleeding. We don't use the Moxibustion because this is a heat. We focus on the hand tie-in meridian and the yang-min meridian. The hand tie-in meridian is the lung meridian. The hand yang-min meridian is the large intestine. The yang-min meridian, why we focus on the yang-min meridian? Another reason, apart from the coupled meridians, another reason is also because of the yang-min meridian. The yang-min meridian got a lot of qi and blood in that meridian. So in this situation, if the patient got excess heat or excess qi, we're going to adjust from the yang-min meridian because yang-min meridian got a lot of qi and blood. So this is the theory. When we study the basic theory, yang-min, the different volumes of the yin and yang, just from the name of the meridians, we will know the volumes of yin or yang, the volumes of qi and blood in that meridian. There is also some debates on the yang-min and tai-yang. In your textbook and the notes, you may see that something different, yang-min meridian and tai-yang. Which one have the most yang? There are some debates on this topic, yang-min and tai-yang, which one have the most yang or yang qi? Tai-yang, tai means extreme or great, large, huge. Huge yang, large yang, similar to tai-yin. Tai-yin have the most yin. So from the name, tai-yang have the most yang, followed by yang-min, followed by shao-yang. However, the same clause, the different clause appeared in the Huangdi Neijing from the classic. It described that the combination of two yang is called min. So in Huangdi Neijing, it tried to define what's the definition of min. It says the combination of two yang, they add on, then we call it min, which means yang min is the combination of tai yang and shao yang. From this point of view, you will see yang min have the most yang qi because tai yang plus shao yang, it means yang min. From this point of view, it says yang min have the most yang. These two clauses are from the classic. That's why there are some debates on the volume of tai yang and yang min. Nevertheless, you will not be asked in your test which one have the most yang. But in general, no matter which opinion you accept, you will understand that yang min and tai yang has a lot of yang. That's why for the heat, for the excess syndrome, we can focus on yang min and tai yang. It can be either the qi and blood. Large intestine 5 is in the elbow. These are also very good at relieving heat. 烧伤 lung 11, we can use the prick for bleeding to cause bleeding. 举迟 large intestine 11 is also a very important point to reduce the heat. 三焦 5, Du14. Again, we mentioned the Du14. In this situation, which technique are we going to use? Moxibustion or needling techniques, reinforcing techniques, or reducing technique? So that's something you can think about for the wind heat attack. The more we discuss, you will see we actually repeat a lot of points. That's also another reason we study a lot of points, but in the treatments, do we use all points? You may from the theory, but from the experience, you also may choose some common points that have better efficacies. 内庭 Stomach 44. Stomach 44. Why we choose Stomach 44 for the wind heat attack? Stomach also linked to the lung. Stomach 44 can help to relieve the heat. The stomach meridian. The hand Yangmi meridian is the large intestine. The foot Yangmi meridian is the stomach, which means the large intestine and the stomach meridians, both of them have a lot of yang, so we can relieve the heat from the stomach meridian as well. That's because of the Yangmi meridian. 三焦 5, 外观 三焦 5 is one of the most important points for arteria. We can use for arteria cold, arteria heat. 三焦 5, also the connecting points of the different meridians linked to Yang Wei meridian. In Nanjing, it is described that if the patient suffers from Yang Wei disease or suffer from disease in Yang Wei meridian, the patient will present as cold and heat. So 三焦 5 have a very good efficacy of relieving heat. Many classics or other medical books have mentioned the function of 三焦 5 to relieve the heat, to relieve the headache. But in the meantime, we need to understand that we will use the reducing techniques for this situation. Patients suffer from common cold. It can be either wind heat or wind cold. This common cold can be common cold or flu or even pandemic, such as COVID-19. In the first few days, it can be the wind cold attack or the wind heat. So in this situation, we will see the thin white coating or thin yellow coating. After a few days, the disease may develop into internal organs. In this situation, if the patient is still not healed, the disease develops into the internal organs. The patient may present as thick coating. It can be the thick white coating or thick yellow coating. It can accompany with this different type of color of the tongues. In this situation, the disease, the pathogen, move from the superficial to internal. One situation, the phlegm and dampness affect the lung. In the basic theory, when we study the lung and the spleen, we said that the lung is the container of the phlegm. The lung is not the The lung is not where the phlegm is coming from, but the container. Although when we cough, the phlegm is coming out from the lung in the tremors. We need to focus on the root cause of the phlegm. That's why you will see the tremor points. We focus on the foot tie-in meridian, the foot tie-in spleen meridian. The phlegm dampness affecting the lung. In this situation, the disease develops from superficial to internal. The phlegm dampness go to the internal. So the treatment principles will be relieving the dampness and the phlegm. The patient may present as coughing, tachypnea, oppressed chest, the wheezing sounds, or the noise in the throat. You can see you can hear the noise from the phlegm. Something like this kind of noise. Now you can see, you can hear that's the phlegm in the throat. The patient may have poor sleep. Coughing phlegm with a lot of phlegm. The phlegm, because of dampness is a ink pathogen. So the phlegm will be white in color. The phlegm also can be sticky. That's also the characteristic of phlegm and dampness. The patient may present as greasy coating, slippery pulse. So the treatment principles, clearing the dampness and phlegm. The method we're going to use, purging method, use the phlegm with heat. Even manipulation methods and or moxibustion for phlegm with coldness. So in this situation, we can use moxibustion because of the heat. The dampness is the coldness, is the pathogen. We can use some yang technique to relieve the pathogens. That's why in this situation, we can accompany with moxibustion. We're going to focus on the hand tie-in meridian, foot tie-in meridian, for the yang meridian, and related back-su points. Lung 1, lung 9, lung 5, lung 7, spleen 3, spleen 6, stomach 40, stomach 36, stomach 13, bladder 20, bladder 20, spleen 3, spleen 6. These spleen 3 and spleen 6 are on spleen meridian. Bladder 20, 脾腧, 脾 is the spleen. So bladder 20 also can use for spleen, especially for spleen deficiency. There's one point here we need to emphasize. Stomach 40. Stomach 40 is very important for clearing the phlegm. This phlegm, no matter the visible phlegm or invisible phlegm. So when I say visible phlegm and invisible phlegm, what do I mean by invisible phlegm? The visible phlegm refers to the phlegm you can see. This is the phlegm when we cough from the lung. The invisible phlegm refers to the phlegm we don't see. If we don't see the phlegm, how do we know there's phlegm? So in our theory, we say strange diseases. Some diseases that's very difficult to identify the causes. Then we're going to focus on the phlegm. So these diseases may be some diseases that don't have very clear causes, or something like the mental disorder. We always think about phlegm. So stomach 40 is one of the most important points that we're going to focus on. Stomach 40 can clear the phlegm, including the visible phlegm and invisible phlegm. The next time when you see a patient coughing with phlegm, a lot of sticky phlegm, no matter what kind of a color, the first points you're going to think about is stomach 40. Stomach 36, 足三里. This is the points on the stomach meridian. This can accompany to strengthen the spleen and stomach. Spleen and stomach are coupled organs. So from these explanations, we're going to discuss the 脏腑 organs one by one, and also from these examples, you will see how we explain these functions, why we choose these points. In future, you can choose other points as long as you can give you a reason. As long as you can provide a valid reason for your prescriptions. If you can provide a valid arguments, your treatments are more likely to be correct, and you also may expect better efficacy. If you cannot explain from the theory, the results normally won't be good. So when we study the therapeutics of acupuncture, you need to always refer back to the basic theory, diagnostics, try to find the reason why we use these points, try to find the reason why we explain in this way, which theory we have used from the basic theory. All those basic theories are from the classics. In the next video, we are going to continue the discussion on the lung. Thank you for your attention.